Amenorrhea. Amenorrhea, amenorrhea. Amenorrhea, often defined as the absence of one or more menstrual periods. Primary amenorrhea refers to amenorrhea in a person who has not had menstruation in the 15-year age group. The most common cause of primary amenorrhea is related to hormone levels, while anatomical problems can also lead to amenorrhea. Secondary amenorrhea refers to the absence of 3 or more consecutive periods in someone who has periods from the past. Pregnancy is the most common cause of secondary amenorrhea, although hormone problems can also lead to secondary amenorrhea. Treatment for amenorrhea depends on the cause. Symptoms depending on the reason for not menstruating. You may have other signs and symptoms, along with missing periods of time, such as milk discharge from the nipples, hair loss, headache, vision changes, excess facial hair, pelvic pain, acne. When to see a doctor, please consult your doctor if you notice at least 3 consecutive periods, or if you have never had a period, and are 15 years of age or older. Reasons amenorrhea can occur for various reasons. Some of them are normal, while in others it may be a side effect of medications or a sign of a medical problem. Natural amenorrhea during one's lifetime. Amenorrhea may occur from natural causes, such as pregnancy, breastfeeding, menopause. Contraceptives. Some people who take birth control pills, oral contraceptives, may not have enough time. Even after stopping taking the pills, it may take a little time for normal ovulation and menstruation to return. Contraceptives that can be administered or implanted can also lead to a lack of menstruation, such as certain types of mobile devices. Drugs. Some medications can cause menstruation to stop, including in several categories: neuroleptics, cancer and chemotherapy treatment, antidepressants, blood pressure medications, allergy medicine. Lifestyle factors. Sometimes lifestyle factors contribute to the development of amenorrhea, such as low body weight. Have a low body weight. Approximately 10% of body weight interrupts many hormonal functions in the body. You can stop the bleeding. Women who suffer from an eating disorder, such as anorexia or bulimia, often stop their periods because of these abnormal hormonal changes. Excessive physical activity. Women who take part in activities that require rigorous training, such as ballet, may well have their menstrual cycles interrupted. Several factors combine to contribute to weight loss in athletes, including low-fat, stress-free, and high-energy athletes. Stress relief. Mental stress can temporarily alter the functioning of the hypothalamus, the part of the brain that controls hormones that regulate your menstrual cycle. As a result, ovulation and menstruation can occur. Regular menstruation usually recovers after stress reduction. Disorders of hormonal balance. The many types of medical problems that can lead to a hormonal imbalance include the following: polycystic ovary syndrome, PCOS. PCOS results in relatively high and constant hormone levels, rather than the fluctuating levels seen during a normal menstrual cycle. The thyroid gland is not working properly. An overactive thyroid, hyperthyroidism, or an absent thyroid, hypothyroidism, can cause menstrual disorders, including amenorrhea. Pituitary gland tumor. A benign tumor on the pituitary gland that may interfere with the hormonal regulation of the menstrual cycle. Premature menopause. Menopause usually begins around the age of 50. However, for some women, this means that the egg supply is reduced to 40 years, and the menstrual cycle will end. Structural issues. Problems with the genitals can lead to a lack of menstruation. Here are some examples. The uterus is covered with scars. Van Asherman's team, a condition in which scar tissue builds up in the lining of the uterus, endometritis, can sometimes occur after dilation and curettage, D and amp. C. Cesarean section, or treatment of uterine fibroids. In the womb, the formation of scars prevents the normal construction and shedding of the endometrial lining of the uterus, endometritis. In the absence of female genitalia. Sometimes during prenatal development, problems can occur that lead to the absence of a part of the reproductive system, including the uterus, cervix, or vagina. Due to the fact that the reproductive system is not fully developed, their menstrual cycles will not be possible in the future in life. Structural abnormalities of the vagina. In the case of a vaginal obstruction, something that can be seen as menstrual bleeding may appear. Using a membrane or on a wall may be present in the vagina, which blocks the outflow of blood from the uterus and cervix. Risk factors that may increase the risk of menstruation, including family history. If other women in the family have experienced menstruation, you may have a genetic predisposition to this problem. Eating disorders. If you have an eating disorder, such as anorexia or bulimia, we are at a greater risk of experiencing menstruation. Sports training program. Strict athletic training can increase the risk of missing your period. History of some types of procedures. If you already have D and C, particularly in relation to pregnancy, or any activity or process that should be known as the groove loop electrodiatmy procedure, LEEP, and the risk of menstruation was higher. Complications. The reasons for the absence of menstruation can lead to other problems. These include infertility and pregnancy problems. If there is no bleeding and no menstruation, you cannot get pregnant. Hormonal imbalance is the main reason for the absence of menstruation, and it can lead to miscarriage or other pregnancy problems. Psychological stress. If you have periods of time where your peers are concerned, these are the ones that can be very stressful, especially for young adults moving into adulthood. Osteoporosis and diseases of the cardiovascular system. These two problems can be caused by insufficient amounts of estrogen. Osteoporosis is a weakening of the bones. Cardiovascular diseases, myocardial infarction, as well as problems with blood vessels and heart. Pelvic pain. If an anatomical problem is not the reason for the absence of menstruation, but it can also be caused by pain, pelvic pain,